Good morning, everyone. It's 8 o'clock on Friday. Happy Friday to everybody. Happy to present today. I'm Clifford Deal, the President of Medical Society of Virginia, and we are going to present a webinar on SafeHaven, the physician and physician assistant PA well-being program. It is my distinct pleasure to welcome our guest today, Dr. Scott Johnson of Hancock, Daniel, our General Counsel, and Dr. Terri Babineau, who I appointed to serve as our Chief Medical Officer for SafeHaven, and Dr. Simon Mittal, a physician consultant and member of the advisory team for VITAL WorkLife. There is the standard CME blurb that I have to read. I'd like to mention the following for purpose. CME purposes, no commercial support was received for this activity, and no reported conflicts of interest for any individual in a position to control the content of this program or speakers presenting in the program. We are recording attendance, and we will submit to VCU for CME credit following the webinar. VCU will email you instructions on how to access your CME certificate at the email you registered with. As an additional reminder, if you participated by phone only, please advise MST by calling or emailing member service. I say again, member service at msv.org. Then we'll report to VCU so that you can receive the appropriate CME. Before we start, I'd like to just mention that the MSV and its staff have continued to work tirelessly to pull any and all resources related to COVID-19 on our website at msv.org/COVID-19. We will post a recording of this call on that webpage later today, should any of your colleagues like to listen who could not join the meeting. We have a large number of people on the call, and I understand there'll be a number of questions. Please use the chat function on your computer. Since we've been doing this since the beginning of COVID, we're all veterans by now. We ask you to keep your questions on the topics, focus on the topics that are addressed today. If we don't get to your question or you have another one, on another topic, please email governmentaffairs@msv.org. With that being said, please welcome Dr. Terri Babineau.
Good morning. I am thrilled to be here as we discuss Virginia's Providers Wellbeing Program. This was a very innovative project that the MSV has been working on actually for years. And many of us who are involved in physician wellness have had input into this, and it is quite different. If we can go to the next slide. There we go. So one of the things that I think is really interesting is it's not just a personal issue that we are talking about when we talk about physicians' wellness. And also PAs, of course. One of the things that Melina Davis, our CEO, talks about all the time is she was going to a meeting, and the meeting had to be postponed because the CEO of a major healthcare group basically said, I had a physician punch a hole in the wall. What can you do to help me? And then, of course, we all know of the situation where as physicians ourselves, there's the issue of feeling like you're down, you're depressed, you're upset, you can't feel like you're able to go on, but also being afraid to ask for help. So we've tried multiple projects in the past, and certainly they've been quite effective. The foundation, the MSV Foundation, has run Infuse, and that has been quite helpful. But as we went and put this program together, as we'll discuss, this is an even bigger program. And next slide, please. We all know that burnout is a major issue. 40% of physicians have been found in a large AMA study to have burnout, and that was pre-COVID. So we certainly know as we watch ourselves, the folks that we work with, the staffs that we work with go under such enormous pressure of, getting infected and sick ourselves, of taking that home to our family and loved ones, of not being able to provide the quality of care or the possibility of that. We've been somewhat fortunate in Virginia. We haven't had the huge numbers like they did in New York, but we've watched our colleagues, having that kind of situation, and often, even in multiple parts of Virginia, up in the Northern Virginia area, they have been hit in areas. So we know that this is a major issue. The highest consistent rates of burnout have always been in the emergency department and critical care. Now it's rather interesting. Primary care went just in the space of 4 years, and this was pre-COVID, went from the fourth lowest incidence of burnout to the fourth highest, just in 4 years. And we might wonder, why is that? There's a very interesting article. It's titled "The Loss of the Doctor's Dining Room." And in that article, it discusses how the collegial state of medicine has changed drastically. I remember, when I was a resident, I would walk through the doctor's lounge on my way to rotations, and there would always be a number of physicians kind of hanging out, having a cup of coffee, talking about their children, talking about the soccer games they were going to go to, talking about a difficult case. And because of the kind of fractured way that we now find ourselves working, typically mostly either outpatient or inpatient, some crossing that boundary, but often because of the pace of medicine that has changed, we don't have that time to be collegial anymore. And often it is the case that doctors don't tend to make friends outside of medicine as easily. Certainly, we try to do that, but it's difficult when you make dinner plans and then you have one case that goes on a little bit longer than you're supposed to, and so you have to cancel, and that happens over and over again. And often family and friends start to kind of feel like they're at the end of the line. And it's often because we have a lack of control. There's little work-life balance often in medicine. And then in addition, we're searching for perfection in an imperfect world. We're born into the world of medicine competing, and often competing against each other as opposed to in that collegial team atmosphere as we go through medical school and residency, always trying to, compete and be at the top of the list so that we can get those kinds of things that, we think will propel our career along. So next slide, please. Then, of course, we have to talk about the elephant that sits in the room, physician suicide. Physician suicide, unfortunately, is twice the rate of the general population. 28 to 40 out of 100,000 physicians will commit suicide, not just attempt it. And part of the reason for this is that we are taught that to be strong is to not ask for help, to not need help. And so, again, in our culture of medicine, it's certainly changing, but there is the perception that in order to be the best, we have to be impenetrable. We can't have any chinks in our armor. Again, aiming for that perfection, which is unattainable. And so when we can't get it, there's some kind of perception that something is wrong with us. Additionally, if we ask for help, there was the thought that it could impact our ability to earn a living and create a negative impression at our workplace, which no longer, the majority of physicians work for themselves. They work for large healthcare groups, and we cannot be perceived as weak. Another thing is we live in a win-loss society. So often we will hear people say we lost the patient, as if, the 99-year-old, lady who had respiratory failure, it was a loss on our part as opposed to just the natural progression. But we never say that we win. So we took all of these factors and with the aid of Scott Johnson, who's going to speak in a moment, went to the legislature to try to change the law, and actually were able to change the law, which Scott will talk about, in order to make it so that some of these factors are no longer an issue. The trying to get a bit of help or to kind of live our best lives doesn't cause us to impact negatively our ability to earn a living or the perception of who we are at our workplace. So we did that, and then in addition, we had to make an intervention that allowed for physicians to fit it into an already overscheduled life. So then we'll talk also about what we did after Scott and his crew were able to move the law in a direction that was very helpful to physicians. So now I'm privileged to ask Scott Johnson, who is General Counsel for the Medical Society, to speak about the law.
Sure. Good morning, everyone. Appreciate the opportunity to share with you. Even though I'm the one speaking, you need to know it was truly a team effort from Melina's leadership through the governmental affairs team over to the general counsel side, and I'm just the messenger this morning. So the first thing we did is we realized that if you're going to incentivize physicians and PAs to reach out to get help, one of the things that is going to come up is you want to make sure that there is immunity protection, so that information can't come out in a medical malpractice case or can't come out in a way that may jeopardize their professional career. So we first went to the Code of Virginia and looked at what was there, and largely have secured through two pieces of legislation, House Bill 1115 that was patroned by Delegate Patrick Hope from up in Arlington, and Senate Bill 120 that was patroned by Senator George Barker from Fairfax, and basically tried to get the same protections for this wellness program that exists today for medical staff committees and a lot of the hospital committees, peer review committees that you're familiar with. The immunity that we secured, one, applies to the individuals participating or providing the care. And secondly, the paperwork and the information relative to what care was given or assistance was given or what actions were done was protected. And, you know, when we went to the trial lawyers, because they are not fans of immunity, they were very mindful of a voluntary program that Virginia has called Lawyers Helping Lawyers. And that program does not exist in our Code of Virginia, but it's a program that's administered by the bar. And they see the benefit in that and realized that they thought it was a good thing that the Medical Society would be the one that would be quarterbacking this. So they worked with us on the immunity legislation and basically signed off after seeing the program and realizing the benefit of it. So we can go to the next slide, please. So what we secured then was amending Virginia statutes to protect, give the immunity protection, but then we had to work with the Department of Health Professions, which houses our Board of Medicine, because there were also reporting statutes at the Board of Medicine that would operate as a barrier. In essence, there is a statute that pretty much says if you have two physicians talking to each other and one physician says, I am really burned out, I'm really depressed, I don't know if I can see those 20 patients this afternoon, I don't know if I can perform surgery this afternoon, that arguably the physician who heard that has got to report the physician who said that. And again, back to Dr. Babineau's point, if you know that's a risk, then the physician that is expressing that is not going to say a thing. It's going to keep their mouth shut. And so we were able to make adjustments to the statute to say if a physician or a PA is participating in this wellness program, that there's no reporting required to the Board of Medicine unless there is a reasonable probability that the licensee is not competent to continue to practice. So no reporting unless there is a reasonable probability that the licensee is not competent to practice. So that was something we worked through with health professions. Given the urgency of this legislation had an emergency clause, and that basically had the effect of saying instead of this becoming law July 1 with all the other laws that the General Assembly passed, it became law when the governor signed it, and that was back on March the 8th. We worked this with a lot of physicians, and as it came through the General Assembly, there was not a negative vote. So we are very appreciative to have this structure in place. And anything else, anytime you have any type of immunity, you've got to make sure you don't waive it. And so we're very cautious in the information and how this program is set up so we can encourage physicians to participate and do our very best to make sure that the assistance that's provided is going to be cloaked with immunity and in confidence. So with that, I will hand back to Dr. Babineau.
Thank you so much, Scott, and thank you so much for your work on this program. The Medical Society has done extensive work. The staff have been really working so hard trying to find an appropriate partner to allow us to produce the kind of intervention that we will scientifically evaluate as to whether or not it's actually helpful. It's been part of our issue with the interventions for burnout and also the prevention of physician suicide is we just have not been able to find one that has been really truly considered to be effective. So we were really happy the staff found a group out in Minneapolis, which is VITAL WorkLife, and they have partnered now with us on the SafeHaven program, and they have a national team of physician peer coaches and also senior behavioral health consultants. They've been at this for over 10 years, and they do have that kind of proven outcome and results that we were looking for. And so we were really happy to be able to partner with them. And I really congratulate the staff at the MSV for the work that they did evaluating programs all across the country and finding VITAL. We're privileged today to have Dr. Simon Mittal with us, who is with VITAL WorkLife, and we'll turn this over to him to describe that for you.
Thank you. I appreciate the opportunity to speak with you guys today. I know it's always one of those challenging topics sometimes when we talk about well-being as physicians and PAs, and what does that really entail. So hopefully this will help to describe some of the resources that are available, and yeah, we'll see how that goes. Next slide, please. So VITAL WorkLife has been around, as Dr. Babineau said, for more than 10 years, and really has a national presence with physician, peer coaches, and behavioral health consultants that can really help with some of those challenges that we face as healthcare workers, specifically as physicians and PAs. And so we want to make sure that you guys are successful, and we recognize that there are things that can happen in the course of practice, in the course of our lives, that can really bring challenges. And so how do we address that? And as Dr. Babineau said earlier, sometimes we don't necessarily, one, recognize where the resources are, and two, really don't necessarily always feel comfortable in pursuing those resources in a way. So we want to make this as easy as possible and really provide the appropriate resources that are really helpful and been proven to be helpful for clinicians. Again, you see the website there, and you can always check that out for some of the other resources that are available. Next slide. So we were in a kind of unique time, and I know for all of us, as we address the pandemic, even before the pandemic, we were already noticing ideas, and there were a lot of indicators of stress and burnout. And so we know there are practice issues, we know there are work-life challenges, those things that sort of pop up sometimes out of the blue, and we're like, okay, what do we do with this? How do I manage that? And then Dr. Babineau mentioned the physician suicide, which is significant. And so even before the pandemic, there's a lot of work that has been done that really identifies the frequency and the prevalence of stress and burnout being quite high. And sometimes you might ask yourself, so how do I know I'm stressed or burned out? And there are some tools that are available that can help identify that. But really, it's the idea we want to enjoy the work we're doing. We want to be successful in the work we're doing. We want to be productive in the work we're doing. And so even before the pandemic, we recognized that there were a lot of issues around stress and burnout. Now with the pandemic, there is a lot of additional issues. Obviously, we've got a pathogen that can be quite contagious, the fear of becoming sick or dying, the fear of harming loved ones, the fear of the unknown. As we all know, there are, there's no discrete beginning, there's no discrete end in what we're addressing at this point as it pertains to the pandemic. And so, we are seeing an increase in anxiety and depression. There's also the idea of post-traumatic stress disorder, really from what some people have termed as an existential trauma, which is the idea that, again, this is not a discrete event, but this is sort of an ongoing thing. And especially as we see, a lot of people passing away, and the impact it has in our work life and the impact it has in our workflow. So those are some issues that we've seen both before the pandemic, but also with the pandemic as well. And so we recognize that there is an increasing need for this. Next slide. So at VITAL, we really look at well-being in 6 components. And I think it's just important just to go through those 6 components really quickly so that you guys understand the framework in which we approach this. And so the professional component, obviously what happens in our work life, the physical, we know that as we get more stressed, we tend to not exercise as much, we tend to not take care of our physical well-being as much. The relationships that we have, both in work and outside of work, there may be financial, legal impacts, spiritual component, and emotional components that may, that where we can bring those pieces together can really bring a positive impact in overall well-being. Next slide. So this is a quote, and by creating a more balanced life, we're more likely to secure a more complete sense of well-being. So one of the things that I often say as we presented other places has been, when you go to a cocktail party, nobody says to the people you're with, wow, I have no stress and I just love what I'm doing and I wish it could stay exactly the same it is. We usually have some concerns that are brought up in the social setting, and oftentimes those stressors may or may not get addressed depending on what parts are really stress related, and how do we then manage that. Next slide. So we look at this in terms of how do we build resiliency, and resiliency is sort of this term of how do I have an increased capacity and an increased tool set to manage the things in my life that may be affecting my well-being. And so again, we look at this, there are a number of components here that we really try to pull together at VITAL to really support the clinician in lots of different areas, and really trying to address these 6 factors. So the first one I'll start off with is the 6 hours of peer coaching. And we do believe that peer coaching is really important. And, we want clinicians who are in the field to address and coach with those people who are maybe struggling, or maybe have some transitions in their practice, or maybe have some specific practice concerns that they may want to address. And so examples, I've been a coach with VITAL for I think almost 10 years now, and in that time, the types of coaching that we have done have been things from, I'm having a problem in my practice, to, hey, I really want to become a better leader, or I really want to transition. I'm thinking about retiring, but I'm not sure how to make that transition, or I'm thinking of making a change in practice. I'm not sure what to do with that. So there may be a number of reasons to consider that peer coaching. I will tell you the peer coaches we have nationally are excellent, and they have a broad experience in their field, but also in building that resiliency and addressing burnout. We do have virtual face-to-face counseling, which again can be very helpful for those times when you may need some behavioral health support. We have a virtual WorkLife Concierge, which I'll dive into a little bit in a second. We have an app. We do have well-being advocates that also can help support the goals that you may have to improve your work-life balance, but also to address some of those well-being issues. Again, we talked a little bit about leadership development. We do have training and education sessions, and then we do have legal and financial resources that can also be helpful as you are thinking about potentially what some of your financial goals are, or if you need some legal support, that's also available. Next slide. So when we think about the peer coaching, it's confidential, which I think is really important to understand. This is something that's really just between you and the coach. You guys, we have both physician peer coaches, certified executive coaches, and really we're here to try and support, again, what some of your goals might be, whether it's to deal with change, to strengthen your leadership skills. Maybe you're trying to find how do I find balance in my work life? Maybe there's some struggles with communication styles, or maybe there's just some time management issues that you might want to address, or just have somebody who's familiar with the work that may be able to help you. If needed, we can use therapeutic providers, but this is not a therapeutic relationship. It's really a coaching type relationship. And it's a great resource that we've had a number of providers use that have really seen significant success. And just a quick story, I was able to coach an individual out in California who had wanted to increase their leadership skill set. We coached for, I think, 6 months, and the individual was really able to kind of step into new leadership positions as a result of some of that coaching and the work that this individual was doing as a result of the coach's suggestions. And so that's just an example. Some coaching, again, maybe just transition in practice, and recognizing that there is a life cycle to practice. And so depending on the life cycle, where you're at in that practice, some support may be needed. Next slide. So again, we have professional support and assistance. We have unlimited in the moment behavioral health, telehealth support, and then 6 virtual face-to-face counseling sessions. And that's also for your spouse, partner, children. And sessions are really designed on, what's the incident. And again, there may be a number of topics that need to be addressed. Maybe it's COVID-19 related stressors, or maybe it's you had an adverse event, or maybe there's malpractice issues that you're facing. Maybe it's some personal relationship issues. A lot of us may be dealing with managing both our family and managing our parents in terms of some elder care issues, or maybe you've had a grief or loss that you may be facing. What we do know is that by providing this support, the support can really help support individuals to continue to be successful, to have an improved sense of well-being, and to continue to be effective in what you're doing every day in your clinical work. Next slide. So one of the things that comes up often is sort of those planning events, and sometimes we just don't have time. Maybe it's an anniversary or birthday, or maybe it's a trip, or maybe it's something that you're just trying to, how do I get this planned? Or maybe I need a babysitter last minute, or whatever it might be. And so VITAL WorkLife has a concierge service, which is available 24/7, and it does help with a number of different tasks. And so it is a great tool that can really be helpful. Next slide. And so again, this is really a tool to help you and your family recharge, so that some of those planning items can be managed by a virtual assistant. And we have a white glove virtual assistant that's successful globally. And here are some of the things that may be helpful: meal prep, relocation. Again, even travel, whether it's for a vacation, CME, maybe you're taking a sabbatical, child services, appointment scheduling. So again, just think about how all those things you try to manage on top of all the other things that you're doing. Maybe there's a project in the house that needs to be done. Well, who am I going to call? How many people do I call? How do I define the project? How do I get pricing? All of that takes time. And so, again, this can help balance some of that, so that some of that time you can use for yourself and your loved ones to recharge. Next slide. So we talked about the app. The app has really got a wealth of resources that can be really helpful. We do have a well-being index that can help kind of identify where you're at in your well-being, and this was created by the Mayo Clinic. There's the Maslow Burnout Inventory, which is a proven tool a study tool that can really help identify burnout. And then again, there's the Mindfulness Attention Awareness Scale, which also is a validated tool. There's also a number of resources you can access. You can tap to call or email your peer coach. You can set your personal goals here, and there's a lot of insights with some videos and articles that are also very, very helpful. Next slide. So what do you expect? What are some of the things that you would want if you're going to approach this? One is that this is a proven process. This isn't something that we just made up. There's a lot of work underneath this that has shown significant success in utilizing the resources that Vital WorkLife has developed. And the first step is really expertise. And many of our coaches have been very, very have really coached a lot of people, have been involved in a lot of peer-to-peer coaching support. We have a very strong behavioral health expertise also, and really the idea is to help you discover where you might be in this process. So one of the things that I want you to think about as you're listening is, where are you at? Where do you think you're at in terms of either burnout or anxiety or maybe some depression or stress or time management? Where are you at in that? And what resources would be helpful for you to be supported to develop those pieces that could help you continue to do all the things that you'd like to be doing? And so again, how do we develop an implementation plan? How do we engage? How do we measure and evaluate success? Those things all become very important. And so again, think about where you're at in this pathway to your own well-being. Next slide. So in order to be successful, we create a team. I think there's an account management team, there's a resource site. We're gonna create a strategic launch roadmap with proven implementation guide. We want to make sure that there's good education and support for leaders and staff. We want to ensure that you understand the advocate program and how do you develop coaching and internal personnel to support the initiative. And also recognize that the advocate program is really essential. It's an important part of how we build this team to ensure that we have all the components in place to help you be successful. And we want to identify internal champions as much as possible. And so again, how do we define that program, how do we develop that program, and build onto that so that there's ongoing sustainability for success. Next slide. So what does the SafeHaven program provide? It's an external resource to seek support. And because of the extra protections that the state of Virginia has now legislated, we want to make sure that that the barriers are removed for you to seek out the help that may be really timely for you and help you continue to be successful. Again, protections from medical malpractice becomes an important piece of this. And then the immunity we talked about, as Dr. Babineau talked earlier, becomes important so that there's the only two reasons that that immunity kind of passes if you're a danger to yourself or other people. And the peer coaches really understand what clinicians are going through. A lot of what we go through is normal, and I think we just need support in how to improve that. And then how do we have the resources, not only for yourself, but also for your family members, especially as we think about what we're going through now from COVID. Thanks for listening, and I'll hand it back to Dr. Babineau.
Thank you so much, Simon. There was one other thing that I also was thinking about as I was listening to such great information. And I was privileged to write a review article, and the title of it was Physician Burnout and Compassion Fatigue, Individual and Institutional Response to an Emerging Crisis. And the reason that I bring that up is because The other thing that we are doing at the Medical Society, and this is a big part of what we are doing, is also talking to the institutions, because we realize sometimes it's like, we've had providers say, and, I've actually felt myself like, wait a minute, I can change all this, stuff about myself. I can improve myself as an individual physician, but we're working within an institutional situation that often also produces and causes us to have some of the factors of burnout. So there are definitely institutional approaches as well. And we, I wanted to make sure we mentioned that it's not like, I have one young doctor say to me, it feels sometimes like I'm being blamed, for being burnt out, when I'm actually working within, a big culture of medicine that kind of produces that. So we at the Medical Society are definitely working as well. Some of the institutional approaches that we spoke about in the review article, we're assessing provider needs and returning some autonomy and control over the workload and also the workplace to the provider. So we're definitely looking at that, talking very much to some of the institutions, the big healthcare groups that we find here in Virginia, because we certainly realize that there's not but so much, that an individual provider can do. They can change themselves, but in order to be truly a productive physician or physician's assistant, they need also to work in a workplace that is conducive to that. So I just wanted to make sure that we mentioned that as well. And it's also, I think, I describe SafeHaven as truly a 360 approach. And meaning we really tried to look at all the factors that prevented physicians from, living their best work life, and also hopefully living their best personal lives in order to have that complete life that they dreamed about when they, were working so hard even to apply to medical school. So I think that, we're always open to suggestions about how we may approach and advocate for physicians. The advocacy team does an incredible job with the legislature, but they're not just advocating, with the legislature. So I wanted to make sure that we included that. And of course, the institutions, they have a lot to gain from having happy and fulfilled providers. The cost of the loss of one physician to an institution, meaning that they went to somewhere else to work or they retired from medicine, is $500,000 to $1 million, and that's just one. So certainly, as we advocate, we try to speak about the dollars as well as, of course, the moral benefits of making sure that the people who work with you are happy. We've also been quite excited. The program is garnering a lot of attention, and other states are interested. Other work groups are very interested in what this team from MSV has put together with Melina and Scott and Mary Beth and the whole crew. I think that you will see that, we will certainly start to move forward with some of that. And as far as I understand, I believe that now, hopefully, Dr. Deal will actually take some questions.
Terri, thank you very much. Dr. Mittal, that was a terrific presentation. It makes me very proud to be a part of the Medical Society as we do this work. I think, having been practiced for 20 years, there's certainly been a lot of changes in medicine, but I think it's our benefit to realize this. I think there has been a lot of suffering and silence for a long time, and this helps us to deal with this. I want to remind our listeners and folks on the webcast, there's a chat function over on your screen. There are a couple of questions that are coming up, and I'm going to direct those. Some of these are going to go Terri, to you. And some of these are going to go to you, Simon. One of the questions is, it's more of a generic question, but do social determinants of healthcare play a role in caregiver burnout?
certainly speak to that, and then maybe Simon may want to add. They do, certainly that has been in the research very clearly, especially in primary care. And part of the reason for that is because of lack of access to care, lack of health literacy. So even if you're trying to provide your best care, the patient may not understand what it is that you're hoping for. Even if you're trying to provide medications, they may not have access to those or access to therapies that you maybe would prescribe. So there's a huge amount of frustration. On the flip side of that, you will find that physicians who work in very many underserved areas, and especially free clinics, tend to have a lower rate of burnout. And part of that is because they have a sense of appreciation of their work. So that's also it's kind of an interesting juxtaposition. But yes, the social determinants of health and lack of access and equality, I think, of access in medicine does contribute to provider burnout.
Simon?
Yeah, this is Simon. I would just add to that. I mean, I appreciate Terri your insights in that, because I do think it's an important consideration, not only in the work we do, but also what may be happening from a relational standpoint with other members of your family that may have social determinants of health that may actually be increasing stress on a personal level as well as on a professional level. And so there are a number of arenas where the stress and burnout may be increasing as a result. One of the things that it'll be interesting to see, we don't have any studies around this right now, would be, as we are addressing this pandemic, the additional impacts of social determinants of health that will have professionally and personally. Because now we're not only thinking about how do I manage my panel of patients, but how am I managing my family to keep them safe as well. So we do know that those may be additional factors that may be playing a role as well.
Thanks for that. One question it comes up every time, which is those were terrific slides. And Mary Beth or Taylor, I think the slides will be available on the MSV website later on this afternoon. Yes?
Yes, they will.
Perfect. And so, Mary Beth, these might be some implementation questions. Well, let me go back to the first one. Is are the coaches physicians? Simon?
Yes, there are a number of peer coaches that we have across the country. So we have a large pool of physician coaches that are able to support clinicians.
There are a couple of questions. These are the implementation questions. Is what does the program cost? Who pays for it? And how can I access it right now?
Possibly.
This is Mary Beth.
Perfect. Thank you.
Oh, go ahead, Terri.
No, I was going to say, please ask Mary Beth to answer those questions. So.
Okay. Sure. This is Mary Beth McIntyre. I'm the Chief Programs Officer for MSV, and so the program costs about $22 a month, $265 a year. We are working to reach out to the systems and large groups across the state to make them aware of the program and to encourage them to participate in this program for the physicians and PAs on their staff. We also are, there is a way for individuals to participate as well. And so on our website, if you do msv.org/SafeHaven, there's a page that takes you, if you're an individual, if you want to look at it for your group, if you want to look at it for your system. We would love anyone that is with a large group or system to reach out to us, and we can work together to figure out how to introduce this program and to have it implemented, to help us implement it across the state.
Okay, Mary Beth, one of the other questions is, tell me about residents in this program.
Yes, residents are available to be covered in the program since they are licensed. The systems groups, individuals from a residency perspective are available to participate, and we are very committed to trying to figure out how to make sure that the residents are included as a part of this.
All right, one of the other callers is writing in a question, and I'm going to comment on the question briefly, and then I'll ask Simon and Terri to chime in. The question is, what would you recommend to a clinician who does not feel supported by their organization to make practice changes that would support their well-being? And I work in a system and deal with this all the time. And part of this, I think, is a Zen, like I've been in the Army for 28 years, and recognizing that is by the trade-off of working in a system is that you have to give up some of the autonomy, and some of those things are frustrating, and you sort of have to have a Zen-like moment to realize that and be comfortable with some of that, and that's just hard, in my opinion. It's very different than when I was in private practice, and then learning how the system works. I work for HCA, and HCA has a process, and that was a different process than when I was in private practice, to learn how to affect change within the organization. Those are not skills that I frankly learned in medical school or in residency. And then I'm going to turn it over to Terri and Simon and see if you have any other comments.
This is Terri Babineau. I so agree with what you're saying, Cliff, because I think we have to realize that healthcare is different now than maybe when many of us even started. Like I said, when there was the majority, when I started in residency, the majority of physicians worked for themselves or small groups of physicians, and so they had kind of control over that. And now the majority of physicians work for large systems. One of the ways that I think we have tried to approach that is using, again, the science. You have to use the evidence. And that's why I brought up the information about how much it costs the system to lose a physician. And, it's not like you're using that as a threat. It's that you're using it to give the leaders of the system, many of whom are physician executives, the information that they can kind of realize, oh man, we may need to change this. And it all went into our thinking when we did when we are creating the SafeHaven program, because it has to be economically, advantageous. So it's not like you're just hitting the individual physicians, you're actually improving the system. There's also some other information that can be had from IHI, from some of the quality improvements. All of the boards have information about, ways that institutions can help. The National Academy of Medicine also has a lot of information about the possibility of institutional change, so that it actually supports physicians and providers. And it's also one of the reasons that, we, like I said earlier, that we wrote the review article the way that we did, because we have to look at also the ways that institutions will change.
This is Simon. This is a very common concern, and I would say when in the coaching sessions I've had, this comes up, very, very often. And so there's sort of two pieces. One is what is the emotional response that you're having to that, and how are you managing that, and what is that stress, and how are we manage, what are the tools that would be helpful for managing stress? And then there's the functional side of that. What are some things that maybe we can do that would help? Maybe they're smaller things than maybe you would want or desire, but are there additional things that you can do in your individual practice to help with some of the flow or some of the stress that may be contributing to what you're feeling and what you're carrying? I manage a practice now, and this is, again, I have providers coming to me, I wish it was like this. Well, I wish it were perfect all the time too, and I just wish there were a way to get there. And honestly, we're trying to balance a number of different things in practices, from access to finances to appropriate care to high quality care and those kinds of things. And again, the resources Dr. Babineau just mentioned are really, really important. And so I think we try to really identify those areas that you may have some control over, and how can we improve those pieces. But recognize that there is an institutional piece. And again, to Dr. Babineau's point from earlier, addressing some of those institutional concerns, is also part of what we would like to be engaged with as well. So it's no short, easy answer to that, but there are resources that can help both on an individual basis and an organizational level.
So there are a couple more questions we want to cover. We've got about 10 minutes left before the hour's up. The first continuing question is, how does this differ from the Virginia Health Practitioners Monitoring Program?
Dr. Deal, this is Scott. I'm glad to take that one. So the Health Practitioner Monitoring Program is administered by the Department of Health Professions. And largely that program is something that is triggered at the point in time that the healthcare practitioner is not able to continue to practice. Generally speaking, to enter that program, whether it's a nurse, whether it's a physician, whoever, you have to sign a contract to enter it, and the terms of the contract generally require you not to practice for the next period of time, whether it be 30 days or 60 days. And that program requires you to undergo an independent evaluation that usually is a multiple week in-person evaluation that can be extremely costly. And we thought that the physician wellness program that we worked on here is a complement to it. It's not a competitor to it. This program will enable the Medical Society and Vital Life Works to reach a physician or a PA earlier in the onset of the need for help, and not have to wait until they get very desperate at the very end and have to go to the health practitioner monitoring program. And that was one of the things that we were very closely in how we worked with health professions to make sure that there was consistency and not competition.
Thanks, Scott. Another question, this may go to Simon. The program looks great. How should I measure success? Retention, quality improvement?
Yeah, it's a great question. Yeah, great question. And when we think about success, there are, again, sort of two levels of success, right? There's an organizational success level and an individual success. So really, when we think about the individual success, it's one, the increased improvement of well-being, sense of well-being, which usually comes from a sense of, okay, I know where I can make change. I know the tool set I can use. I can navigate those sort of day-to-day pieces, and both in my personal life, but also in my professional life. The organizational success, it can be measured lots of different ways. There is a well-being survey that can be done within the medical staff group. There is, again, retention is a big one. Turnover can be an important measurement as well. So there are a number of ways of sort of defining success, and there are specific tools that can be utilized to demonstrate that over time. And so that's what part of what Vital WorkLife has in its armamentarium.
Right.
Also, Cliff, if I could add to that, we have been, the MSV has been working, as a matter of fact, I think we have a 2-hour meeting this afternoon, working very closely with Vital WorkLife to make sure that in addition to what Vital WorkLife is doing, that we are looking at the comprehensive program for the MSV as well. And in addition, what we have been, just like the factors of doctors don't use the EAPs from their employers. Often they don't fill out the wellness, evaluations and that kind of thing, because they really don't want their employer to have any access to much of their private information. So we're trying to mitigate that by, again, it being protected information through the MSV. And also, Scott, I think it might be an interesting thing for Scott to talk about how that information cannot go back to the employer if he would, because that's another way that we're trying to really insulate providers so that they can get some help.
Sure, and maybe the best way to explain that would be by an example. So if a physician was concerned about participating in the wellness program but decided, okay, I'm going to do it, and they participate, and then they are sued in a medical malpractice case, you don't want to have the ability of a plaintiff's attorney to say, oh, you were in the wellness program at the medical society, and then send a subpoena over to the medical society to obtain all of the paperwork from the medical society or Vital Life Works. You don't want a request to depose anybody like Simon or Dr. Babineau that may have been involved in the program. And so by putting the immunity in place, we have covered that on the front end, but immunities can be waived. So we don't want a situation, if you use Dr. Deal as an example, if he's the one receiving assistance under the program, you don't want a situation where the program goes back and tells his employer, HCA, well, Dr. Deal came in and here's what we did for him. And here's a report on this, because that can be discoverable in a malpractice case. So instead, if there are hospital systems that are going to, in essence, pay for or sponsor their employed physicians and PAs to participate in this program, you only want them to receive aggregate data, meaning, you know, we have 1,000 physicians participating in the program, 15 chose to avail themselves to this. Talk about in generalities, but nothing that is provider specific or nothing that would enable somebody to go back and extrapolate and peg it back to that individual person. We also think too, if a physician thought that their hospital system could find out if they participate in this program, that's going to be a deterrent and they're not going to be inclined to do so.
Thanks, Scott. Again, this might be another Mary Beth question. If an institution wanted to provide this to their clinicians, should they contact Vital Works WorkLife, or should they go MSV to get access, and who should they talk to?
Actually, they can contact either one of us, but it's fine to contact either one of us, Vital WorkLife or MSV. We both are prepared to answer and help anybody navigate how to bring this to your system or group or you individually.
And then this was another pricing question. Talk about a little bit more about the pricing model. The $275 is for referral to a coach, and then more fees later for the coaching, or is the $275 all inclusive?
It's $265 for the year, and it is all inclusive. There are no additional fees for the coaching or for the consultation services.
All right, thanks. Another quick question or two before we wrap up. Another caller says the website says face-to-face counseling, but what we said today during the webinar was this is not therapy. Can you clarify that, Simon or Terry?
Yeah, yeah, go ahead, Simon. I think that would be better for you.
Yeah, again, the idea is that there is a behavioral health support, and if you are needing additional counseling or therapy services, that is then referred. Then we would make a referral to that or provide some resources for that. This is really behavioral health support, and it's sort of a subtle difference maybe between those two. It's kind of but we're not here to establish therapeutic relationships in the sense of psychological, but we do use psychologists and social workers that are very, very talented in supporting the concerns that arise for clinicians. So there is a slight difference between a therapeutic relationship and a non-therapeutic relationship, but the value is that because you have access to behavioral health resources, it may actually help support enough that you may not actually need the psychological or therapeutic services in of itself.
Simon, that's great. Terri, thank you. We're going to wrap this up. Again, from the Medical Society, I just wanted to say thank you all again for joining us this morning. as human beings, even surgeons are social creatures, and as we go through our journey in medicine, friends, family, faith, and our peers help to support us and successfully navigate this. So thank you very much for Dr. Mittal and Dr. Babineau, Scott Johnson. Thank you for participating, and we will, again, msv.org/COVID or msv.org/SafeHaven, and we will see you all again next week. Thank you all very much for participating.